Okay, so just diving right in, I just like to reiterate that the affirmation has not been thorough enough in defining federal funding for this. Again, because this law, or because death of dignity, physician-assisted suicide is not recognized federally, federal funds cannot be used to cover the expenses for medications. This is reported by the California deathofdignity.org, and it's federal law. And there are some cheap alternatives to the already very costly medications, and it's a mixture which was created in 2016 by researchers from the Death of Dignity National Center, and it is a combination of phenobarbital, chloral hydrate, and morphine sulfate. And this is one of the new mixtures, which price around $500 according to the center, but have some very, very troubling implications. First is that the morphine sulfate used in this drug, if used with a patient, most terminally ill patients have experience with narcotics, specifically morphine, and if they already have a high tolerance to morphine, there is a chance that this mixture will not work on them, meaning that they will have prolonged hours of death, some even going up to 31 hours. Second of all, the fourth recommended ingredient to this mixture is for the patient to consume 200 proof or 100% ethanol, which is alcohol. And this is just because the alcohol makes the drug absorb better for the patient. And you know, what type of dignity is this for a person to consume 200 proof, 100% ethanol? That's, you know, an ungodly amount of alcohol, but it's recommended for use because of the better absorption rates. However, if they do not choose to use this, they could just take water, but it's also recommended that you should take some alcohol of any kind. Again, according to Dr. Parrott, in an interview with the Los Angeles Daily News, she says that we run into patients who are so tolerant and dependent on narcotics that even the astronomically high doses of oral narcotics in our prescription do not stop them from breathing. So there are very troubling missteps in physician-assisted suicide. It's not 100% like the affirmation makes it seem. There are still steps to find the best mixture to have a dignified death, but at the current times, it's not completely found, and this is very problematic and troublesome because these drugs are given to patients with no supervision. The Oregon law mandates that, again, there's no witnesses required. The only thing that is required is mandatory counseling and 2 different prognoses and prescriptions from doctors. And again, like my partner stated, the Oregon law is not 100% thorough in the requirements for doctors. There are, again, if a doctor were to make a misdiagnosis, a misprognosis, and hasten the death, like there has been, and like what my opponent has stated that there has been in the past, there are no civil or criminal, or they're given civil and both criminal immunity from any type of side effects that may happen. So this is, again, more troublesome problems that come with PAS. Again, another study from the Mayo Clinic says that prognoses are dangerously inadequate. And I quote, the Mayo Clinic cited a study in which survival predictions were made for 460 patients in hospice programs, and only 20% of the predictions were accurate. And this is, again, more troublesome things that could happen if this law is enacted. Thank you.